Hi everyone. We have some attendees just joining us now. So I want to welcome Jay and Lawrence and Manoj and Margaret and Ola and Ruwan and Stephanie and Taryn and Sharon and William and Tom. We have many prospective students just joining us as well. I want to welcome each and every one of you, whether you are joining us from Australia, from New Zealand, from Canada, from Samoa, from the United States. We are so glad to have you here. I'm Associate Professor Nicolette McGuire, and I'm joining you today from Nova Scotia, Canada. And so I'm pleased also to have our student ambassadors here with us as well. So we have Jason Quick and Fiba Muthril. We have Elizabeth Mills. I think we also have Wila Laifa Lima. And I think that's all for our student ambassadors. So last but not least, I want to provide a very, very warm welcome to our guest of honor this evening, Dr. Pearce. So thank you so much for joining us, Dr. Pearce.
My pleasure. Thanks for having me.
So the way that this session will work is I will be providing some information for Dr. Pearce to answer your burning questions. If you have some additional questions that you'd like Dr. Pearce to answer, please go ahead and type them in the question and answer box, and we'd be happy to get to them throughout the session. If you have questions about general admissions, I hope you'll join us for the upcoming admissions info session in August. But if you'd like to know a little bit of information from our current students who are here as our student ambassadors, or from Dr. Pearce, I invite you to ask those in the Q&A box. So, Dr. Pearce, I'm going to start with you. I know that you have 3 roles at the moment. You're a very busy doctor. So would you tell us what are those roles, and what's a typical day like for you?
All right, yes. I don't do things in half. So yeah, I've got a few hats at the moment. I'm working with the Royal Flying Doctors. It's a retrieval physician role. And that's based in a place called Mount Isa. So that's, if you look at a map of Australia, it's pretty close to the centre of Australia up north. So it's a pretty incredible role. I'm very honoured to work with the organisation. Haven't been asked to be on the TV yet, but Jason knows that I certainly got a face for it. So we'll see if I get the Guernsey. Another role is in general practice in a place called Ocean Shores in New South Wales, so different state. And I also now, actually where I'm calling from today, part of the OUM Doctors group. So I do some phlebology. Also now looking at doing some vasectomies, reversals, and a bit of lipedema surgery, which is all in the context of managing swollen legs. So yeah, I've got a bit on, so but it's good.
So how did you come across those positions? How did you end up doing what you're doing now?
Yeah, look, I'm now almost 7 years out from completing my degree, so I've kind of mixed around and travelled around a bit. I'm studying to be a rural generalist, so hence why I've got a few little hats. I did start my training off in emergency medicine, and then diverged to a bit of anaesthetics, and then put my hat into some intensive care, and then I finally found my niche in a bit of everything. So yeah, it's good. It's good. I've hopefully found my place, and I can kind of settle down a bit.
I think so. I know just even from when you were a student, you had many interests and took a lot of time and effort in all of the studies across all the different clinical areas. So I'm glad actually that you had a chance to bring that forward as you've been in your clinical practice. So glad to hear that. I want to know a little bit about your background, because you didn't start, as someone who went to university into a pre-medical program straight out of high school and then right into medical school. So tell me a little bit about your background. What were you doing before you came to OUM?
Yeah, so you can tell by the grey hairs in my beard that I'm not too young. I'm not as old as Jason, but so it's yeah, so I started my journey as a personal trainer, which is probably why I can tell that I'm quite fit looking. And then I progressed in my career into paramedics. So I studied my undergraduate in health science. Did 7 years as an advanced life support paramedic. The last 2 years was in air ambulance, and that's when I kind of got the bug, thinking that I'd like to explore medicine and see what it has to offer. And I've kind of moved around a little bit, which is to the demise of my wife. She hates it. She's done. But yeah, so the journey's been good. But paramedics first, and then into medicine.
So tell us a little bit more about that bug that you're describing. What made you want to make the change? Why did you want to pursue medicine after having a career as a paramedic?
Yeah, I think as you can see by my journey thus far in the last 7 years, has been quite interesting and diverse, and different states and different jobs that I wouldn't even think about doing. I would have never thought about. I was doing a vasectomy, even 2 years ago. So medicine offers changing landscape, ability to move interstate in Australia, overseas. Certainly over the robust, interesting program that OUM offers, I think it facilitates quite a diverse, confident doctor. So I think, just more diverse in my role to improve my ability to provide care to different people in different situations.
So when you made this decision to move from paramedics into medicine, what kind of program were you looking for, and what went into your decision?
Yeah, so I was in air ambulance, and I actually flew to a country town, and I saw actually a current OUM student. At the time, I was sitting my GAMSAT and working towards getting into an Australian medical school. And I actually got an interview in South Australia. And then she kind of presented this curriculum with really interesting people, robust program. And so I did a compare and contrast, sat to my wife and explained to her that I want to go back to medical school. Once she got over that, then I said, "What do you reckon? Should we go to South Australia, or should we do an adventure?" And we chose the adventure.
So I think what you're referring to, I mean, the program you went through is slightly different than the one we have now, but it's the same setup where there's a hybrid of online as well as in-person clinicals. So the first years of the program are all live, interactive online courses, and then the clinicals are all on-site, obviously. So tell us a little bit about why you ultimately chose OUM.
It's again a little bit older. Life doesn't stop, response doesn't stop. So the first half, the preclinical phase, being able to complete work whilst studying. Great in theory, but I'm sure you talk to your ambassadors about working while studying. It's certainly a strong feat. So especially we're a bit older, we have families and other dependents. So something not to be underestimated. So it was more the versatility program, but also just being able to. I was lucky enough to go to Samoa and do some time over there, and I certainly explored different health systems. So I think I don't like boring life. I think OUM offered a robust program that was recognised. It was getting results. I saw people who were actually practicing, not only just in this country, in Australia, but so it was a combination of those things. So it was actually really a no-brainer.
I want to ask you a little bit about clinical rotations and about doing clinical rotations in Samoa, but I want to ask you something first, which is, I think there will be attendees tonight that are also maybe have families, maybe have long-term relationships, or in partnered situations. So how does someone go about having this talk with their significant other or with their family about starting medical school and having that conversation successfully, since you have already gone through that process? Can you give them any advice?
I think 100% open and honesty. I think if you downplay or point at rose-colored glasses, I think you're going to find yourself in a heated dispute when you're trying to study for an exam or prepare for something. I think it's I think how OUM's progressed in terms of, I was just speaking to Jason yesterday about the clinical program in terms of how much support OUM's offering now with people on the ground. That's certainly changed since when I was with OUM. It was pretty much we used our existing contacts and made our own contacts to get placements. So it was just having that open discussion about this is what I want to do. This is how we're going to do it. You have to be flexible. And I mean, I was fortunate. I didn't have not fortunate, but I didn't have a child then. So that's certainly, I think, a complicating factor. And luckily, I was lucky enough to my wife to come with the journey with me. So I certainly think if you can be hey, let's do this together, we can, explore, Australia or the world even together. But I think just being open and being critical is the main thing. Almost look at it at a negative slant, and then if it works out better, awesome. But if it goes that negative, at least you've had that discussion now before you've got to study for an exam, because they always pick a time. They have a pick a time.
I think that's very good advice, because you are and were an incredibly hardworking student, and now you're an incredibly hardworking doctor. And I think it's important for students and their partners to understand the amount of time that takes. So being open and honest at the outset is really important. And I just want to touch upon, you were talking a little bit about the new supports that OUM has that are additions since you went through the program, but things like our academic advising program, we now have 24/7 academic advising support. And we have research advisors that support students to complete their research project, which is a requirement of the degree, but you do not have to have a research background in order to complete the medical degree, or you don't have to have a research background prior to coming to OUM. That's why we have our research advising program, as well as our clinical mentors. So I know some of that was around when you were going through the program, but I think important to note. And if prospective students, if you have questions about that, we do have our student advisors here, so feel free to put some questions in the Q&A section, and we'll be happy to get to those questions a bit later on in the session. So I want to talk a little bit about the preclinical program and the rigors therein. So what would you kind of advise people in terms of what might be expected of them in terms of the amount of time or the amount of critical thinking or the level of study and commitment that they might need to get through the preclinical years, which are the first 2 years of the program?
Yeah, look, they're tough. I mean, I come from a paramedic background, so you have some areas of strength. So, if you've got some nursing staff, and other allied health, that certainly helps. So it's a matter of treat it as like a full-time job. I think 40 hours is a minimum, to be honest. And it's going to be organised, and the curriculum is robust. So it's not a, you don't need. Look, I mentor a lot of local graduates and local medical students through my various roles. Sometimes I think, gee, they have it easy. So I think certainly OUMs have got a very robust. It's a tough curriculum, but I think it's doable. It's nice. There's no fluff either. It's all medicine stuff, yeah. So that's a great thing about the postgraduate stream. So I think it's organised. Cardiology was a nice subject for me, but immunology was tough. So I think you just take those rest times that you maybe might not, might 30 hours one week because it's a module that you're comfortable with. Use that time to rest and recharge, go for a run, do some fun stuff, and then know that the next week you might have to do 60 hours.
So I'm hearing you talk a little bit about you and Jason chatting together, and I know that you knew each other before the program and maybe a bit through the program as well. And I want to touch upon that because, particularly in the preclinical years where students are going through the live online courses, you may think, well, I'm just sitting by myself at my computer. I'm not going to know any of the other students. But what is the culture and camaraderie kind of like among students and cohorts? Can you tell us a little bit about that?
Yeah, I think isolation is a big thing, hey? You haven't got to compare yourself to peers. You can't grade yourself. So that's where the Student Association came into play, and certainly myself and a few other colleagues put a lot of hard work into establishing that. And so it's reaching about the peers, colleagues, but also your academic advisors and mentors. The mentor is very important. So it's your own requirement to have a mentor to tick a box. But I still speak to my mentor now. So I think treat the mentor seriously. Yes, you do have to have one. But think about, they really, you lean on them when you need them to bounce off stuff. And with the Zoom now, I think it's you can have a group study session quite effectively. So I think that's one positive out of COVID, if you can drag that over.
So just talking about requirements, let's talk about the requirement for a rotation in Samoa. So the way that the school is set up at the moment is that students do their core rotations in their local regions, and all students have a requirement to do an elective in Samoa. The requirements were a little bit different when you went through the program, but the rotations in Samoa have not changed all that much. So can you tell us a little bit about your experience doing a clinical rotation in Samoa?
Don't get out of it. I don't know, there's always avenues. You can blame COVID, you can blame, supply chains, whatever key phrase, but just plan you're going, bring your partner, bring your family. It's an amazing hospital, amazing culture. The Samoans are beautiful people. It's paradise, and it's good medicine. It's complex. They're complex islanders. So I think I was there for 3 months, and so I did with general medicine, surgery. I didn't do any community medicine, so I kind of wish I did that, but yeah.
So what would you say are the kind of main differences in doing a rotation in Samoa versus doing a rotation in Australia?
Well, it's a cultural difference, isn't there? I think it's important to acknowledge, the origin of our university. It sets us streets ahead of a lot of other, for a better word, comparable ways to study medicine. And I think it's important for us as doctors to be. Australia, a lot of countries now are multinational, so lots of different cultures. So I think it's important to experience different cultures and different delivery of medicine. The fundamental books, the textbooks are the same, language is similar, but I think the way to approach medicine is slightly different in terms of, we have availability of all the bits and bobs in terms of investigations in Australia. So I think just bringing it back a bit to more clinical medicine is really important.
I like what you said about, thinking about that being our origin. And OUM has this incredible diversity in terms of student ages and birth countries and first languages spoken and locations now, and yet we can all be in classrooms together learning from each other. And it really has a way of kind of enriching the experience. So I don't think it's just the Samoa rotation that allows for an enrichment of the experience, but having that exposure to different ways of learning, different cultures as you're in the same classroom, I think is something that's unique about the style of learning that we have at OUM. So I'm happy to hear that, and also to acknowledge that Samoa is our home base, and we're so lucky to have this beautiful country, these wonderful welcoming people, and the incredible opportunity to have rotations at Tupua Tumasese. So I'm glad that you had the experience to go there and yours was not interrupted from COVID. And we've now, as of September, we're now restarting rotations, clinical rotations in Samoa. So that's really good too. Sorry, what were you going to say? Please go ahead.
Yeah, so you just Google it, and then you push the Zoom button, and you just realize how isolated this little country is in the middle of an enormous sea. So I don't know, it's humbling to be able to deliver medicine in such a remote place.
So tell me a little bit about what your favorite rotation was. What was it like, and who did you learn from?
It's pretty hard to make a favorite. I think every rotation I had was incredible. I was fortunate enough to spend 3 months in Nepal, in Bratnagar, which is right on the border near India, when I was doing a endoscopy, and the power turned off, and this poor chap was on the end of the scope, and we had no power and no suction, no light, and that was kind of what you had to deal with. So that was incredible. And just the delivery of care without any modern investigations, because it couldn't be afforded. And then India, over 1,000-bed hospital, having, like 40 theatres or something crazy. So it's, I can't. I can pluck so many positives out of so many rotations. I was over in the West in Australia, in Geraldton, on the windy coast there, and doing surgery. It was incredible. And then back to Melbourne, doing some primary health care in an alternative setting. So I can rave on about all my rotations, to be honest.
So when you get to the end of clinical rotations, then you have a few, steps to jump through, hoops to jump through. So you still have things like the FCE and OSCE. So what was that like? Was that a huge barrier to get through? Did you feel prepared at the end of your clinical rotations? Tell us a little bit about that.
Well, if you're embarking in medicine, get used to exams. They won't stop even when you finish. Tough exam, hey, the FCE. It's a good exam. It's you put the hard work in, you get through it, and then you'll be prepared for the AMC, which I think is a lot later question, so I won't harp on that. And the OSCE was just great. It was 8 of us met up 2 days beforehand. Dr. Mishak, he's now kind of retired from OUM now, but he was an incredible human being. And we got to practice face-to-face with these people that I've been seeing on the computer for so many years. They were fair exams, tough exams. Again, great preparation for AMC Part 2, if that's the way you go. It was just enjoyable. Exams are always stressful, but they were fair, but they were tough, which is important, I think.
So I'll just clarify that FCE is the final clinical examination, and that's a multiple choice exam, so it's structured similar to AMC1. And then the OSCE is the objective structured clinical examination, and that's an in-person exam where you have to show off all of your clinical skills with mock patients and clinical examiners, and that's very much like the AMC2. So I am going to jump and ask you a little bit about AMC1 and 2. So tell me a little bit about your study strategy for AMC1 first, and then we'll get into AMC2.
Great. Also, my son was only 6 months old, so he was my newborn assessment. So it was really quite good to use him. He just lied there for hours. It was great. Anyway, we fed him and stuff like that. All right. So AMC Part 1. So your multi-choice test. It's a tough exam. It's a beast in itself. I suggest keep your study material that you did for FCE, because you can just revise that and then modify a bit. I did use a local organisation as a tutor. It's about learning examiner. Certainly for OUM, it's important to learn your professor. They like their niche things, and no doubt that they'll be on the exams. So same for AMC. It's all about learning examiner. So I would always recommend to keep your notes, study those, and then add on whatever the preparation kind of courses or people you speak to.
So maybe it's an obvious question, but was it hard? Was it difficult to pass the AMC 1 and 2?
So AMC Part 1, it was easier than the final clinical exam. Well, I found it easier. I think, so I think, it's the gravity of this barrier exam. You can't practice without it. So I think that's probably the biggest thing. It's just you to really adopt some core fundamental exam preparation stuff, which is, don't leave the last minute, don't cram, set yourself up beforehand. So that's really important. And so for AMC Part 2, I'll just quickly embellish a bit more on that. There's 2 ways to get through that exam. One is to sit a OSCE type examination, which got a pass rate of about, 20% or something. Or there's a work-based assessment program, which goes over 12 months. And that's accredited in various sites or hospitals. And that's changing every year. I was fortunate enough to do the work-based assessment, which has got a pass rate of in the 90%. So it's certainly, and look, those numbers are probably 5 years old. So excuse me if they're not up to date. It was doable. It was a fair exam, a work-based assessment. You have someone come in, assess you doing a clinical examination or a case-based discussion. It's a lot of work. It's a bit expensive too. So it was $10,000 about 5 years ago. So I hate to think what it is now. But it's a fair exam as opposed to the OSCE. But again, same thing. OUM has good curriculum. Save all your notes. So you can pull them out and revise them. If you use flashcards, Anki cards, whatever your method is, certainly keep them on standby for when you need it for the next hurdle.
I'm going to pivot a minute because you mentioned your infant son, and I did see this very cute picture of you at graduation that was posted by the National Institute of Integrative Medicine congratulating you. So I want to ask, what was that like, studying medicine and trying to get through rotations, having an infant at home? Because I know many of our prospective students may have families as well, and they may want to know what that's like. We have a question from Manoj, who has 2 children and wants to know your advice in terms of enrolling at the uni.
All right. Obviously, you're talking about me being the cute aspect of the photo, not my son. But yeah, it's tough, hey. So I decided to get for us to fall pregnant and then have a baby like 6 weeks before my final exam, which is a really poor decision. But you can't control nature. I think it's about, you need to allocate study time. You need to block it. You need to be really rigid and organized. Certainly, I think some of the ambassadors might have children a bit older, which would be another thing. But you need to set also family time. So you need to say Sunday afternoon, no study, spend with the family, and just gotta be rigid. You gotta get up early, go to bed late, and sleep's optional. Of course, you need some sleep, otherwise you won't work. So it's just find that balance of how many hours minimum you need, and it just, you need to have your block away where the door is closed. Mum and dad is studying, and when it's family time, no textbooks, nothing like that. And you also, if they're a bit older, you can get them reading some flashcards for you. You can start, picking aspects of their anatomy on their, and get them involved in your study and learning. And they're helping you. You're spending some time, but you're also getting something out of it. So it's be inventive.
I do have another student who has her daughter read her medical textbook to her while they're driving to school. So I think you can be creative in terms of involving your children. So what does your son think of dad being a doctor now?
Oh, he doesn't care. He just wants me home. I think he'd prefer if I was a garbo just home every day. I've got the coolest job ever. Like, I'm in a role flying doctors, and he just doesn't care. So I think that's the thing. So I think he just wants dad. So it's really hard to have that balance. So I think it's, again, open discussion, involving your children in the decision making, or at least allow them to perceive they have a choice in decision when we clearly know that they don't have a choice. But if you make them feel like in the part of the team and helping you towards it, they'll get some gratification when you go to graduation, holding up the diploma, that their name should be on it too.
So there's a question from C. Karen, who asks, if you have a day job, how did you manage it? Which you did have a job during your preclinical, so how did you manage that time? I know that you had to have clear family time and clear study time, but if you were also working, how did you work that in?
It's about picking an appropriate role, yeah. So I was a paramedic in mine, so I sat on my bum, and if I wasn't seeing patients, I was reading my textbook. So it's about utilising the time. Also worked as a lifeguard on weekends at the local pool, because we were just gearing up to not work for a while, for 2 years. So it's about strategizing it. So I think working with your mentors. Another thing with OUM is that you can do blocks, yeah. So there's also minimum requirements to meet per year, but you might decide to go, 2 modules together and then have time off a block where you're locum for, so there's not always have to work. There's different ways to skin a cat. So that's why speaking to the faculty, your mentors, And if you need, but one thing I didn't mention before, is that you need to talk about money. You need to talk about how you're going to afford to do what you need to do before you start. So that's super important. Otherwise, I've had colleagues who are very, very intelligent and smart, but they've run out of money. And that's the reality of it. So you've got to make sure you prepare for that too.
So one other question about managing your studies. So Kimbari wants to know, how did you manage your study? Did you have friends doing the exact same program whom you studied with, and any form of ongoing support?
So I didn't have any friends. I had friends follow, and which is great, but no help to me. I had a few study partners. One guy who was a bit of a jerk. He's using me, so he's about picking your groups. I'm a bit of a passive chap, so yeah, I think it's going that self-reflection. I think it's really important. Going, okay, am I achieving what I need to achieve? Am I spending enough time with the family? Am I earning enough money? Am I getting marks? It's really that internal review that's really important, bouncing off of your advisors. And that's, again, mental, so important.
So Kimbari also asked about finding a job. Was it more difficult to find a job being an IMG versus an Australian graduate?
Oh, so there's a few hoops, hey. We haven't got a guaranteed path, which is always unsettling, but there's a few of us now who have graduated. So there's a lot of pockets, more so in Queensland and Tasmania, who know. I mean, that they know what OUM is about. Like, they don't go, oh, what's that? Is that even a uni? They know who we are. We've had about I think 12 now down in Tassie, down the northwest corner. Certainly up in the Sunshine Coast is known, and with Prof Bartholomew in the mix in the Brisbane sector. So it's a bit more known now. It's just about meeting your minimum requirements for each state, and that changes for year depending on the workforce. Certainly COVID's helped the workforce demand. So if you're graduating soon, I think that's probably not a bad thing because of the closing the borders and whatever else. But I think it's about being an open mind, and it may not go to plan. So always have a plan B it may protract in terms of time frame. So you won't just finish your degree and then get a job straight away. There's a few hurdles to jump between. So
I think it's important to note that there are some additional steps, but not necessarily, there's no bias against someone just because their degree comes from a different place than where you're looking for a job. So there is an opportunity for New Zealand students to take the NZ Recs, for US or US bound practicing students to take the USMLE steps, and for Canadian students to take the MCCQE. So there's no kind of full barrier to practice. It's just kind of what you make of it, how you use your flexibility, and how you come to an understanding about how and where you'd like to practice, and how flexible you're going to be about that. And I think that's
true. I'll jump in quickly.
Please go ahead.
Sorry, I'll be a devil's advocate. There is a restriction. I think it's important to acknowledge that. That you are not treated like a local graduate, but you offer more than a local graduate. There are some places where you will not get an internship, and that's okay. I don't want to go in anyway. But it's important. Again, this is my perspective in going. Look at the negatives, and it's really important to acknowledge that. So there are barriers. You are treated differently. You are an IMG, which means you have restrictions in billing. You got a 10-year memorandum in your Medicare billing. That's okay. You can work through that, but you have to know it, and you have to be realistic that there's some places. Melbourne's very difficult to get your internship. New South Wales is very difficult. Forever Change, Prof Bartholomew is putting a massive work, up to Parliament. So there's OUM's on your side, but it's tough. I just have to reinforce that, because rose-colored glasses is really easy to do it. But you have to make sure you have to be realistic, and it's worth it, but it can be tough.
I think it's important to note too that where you are doing your clinical rotations, like you're able to build connections. In Canada, for example, there are dedicated residency positions for IMGs, and with COVID, as you mentioned, governments are trying to ease some of those restrictions. So I think it's important to know that going in, that your pathway will be different, and you may have some additional things that you have to do, but you can be fully capable of practicing. So I think important to play both sides of devil's advocate there. So I want to talk a little bit about the interviews that you had for internship positions. What was that like for you? How were you able to get internship positions and to move through those ranks? Tell us a little bit about that.
Yeah, so it's difficult for me because I'm a bit shy. So sorry, I've been facetious, but we're interesting people. People who attend OUM aren't boring people. So I think that's a benefit. You've got so much to talk about. They're more interested about what you've done, where you've been, than the official exam questions. So I think just the unique nature of our curriculum offers a lot of discussion points. So I think it's very dependent. Some people like interviews, some people hate them. Certainly, you can prepare like any other exam.
So what advice would you give to our prospective students that are here today about whether they should apply to start medical school? How would you advise them?
Yeah, so I mean, you can do all your research and you can Google and you can do yourself crazy about getting all the information. I think that's important. Have a discussion with your family members, close and all your support networks. And I think all the ducks align and you've got ability to fund it. I'm not sure why you should hesitate. I think you just have a crack at it, and knowing that you've got some interesting years ahead of you.
And for students who have just started the program, so we have some of those joining us today. So what would you advise students who are just at their very beginnings of their medical school journey?
Stop Googling requirements for AMC. Stop Googling, are they going to ban OUM from practicing in Australia? Oh, I did it. You have that uncertainty. Stop thinking about, I want to be a good doctor, so I need to study hard. You can't be a doctor without your degree. So you need to be a good medical student first. You need to get your passing exam in front of you. Otherwise, it doesn't matter how awesome you are at putting a chest tube in someone. If you can't pass your renal module exam, you can't do your clinical. So I always say is don't worry about being a good doctor. You need to be a good medical student first.
I'm good. Abby would like to know, where was your internship?
Yeah, so it's in northwest Tasmania, in a place called Burnie.
And Ruwan wants to know, did your overseas rotations in Nepal make your application for jobs stronger?
So, because of the increased exposure, I was noted when I was in theatre. I had better technical skills than other interns. I had better practical skills, and this makes it interesting. It's not necessary. I don't think you have to do it. Certainly, if your family constraints don't allow you to do it, then I wouldn't break your neck to get over there. But again, it makes it more interesting. It makes you stand out. And I think that's all about it. There's so many good applicants meeting, they've got AMC Part 1, maybe it's 2, they've got this, that, you've got a degree that's recognised. What stands you out is the extracurricular stuff you do.
What you want to expand on that a little bit about the extracurriculars? Do you mean just like overseas rotations, or are there other things?
I think and hence why I'm here, it's about contributing to the greater picture. Supporting your university, be proud. So I think the biggest thing is if someone asks you where you're studying, you say that with confidence, and and say, this is what I'm studying, and own it. And people are, oh yeah, cool, they'll ask about it, right? If you go, oh, you mumble and stuff, and they'll think, oh, you're not very confident with your studying. So, I mean, I was involved in, advisor groups and workshops, and also the Student Association. So I think it's important to give back. Be careful not to be too involved, though. You need to spend, you kind of overload yourself. I overload myself, do it all the time, but I wouldn't recommend it.
Were you president of the OUMSA?
Yeah, I was. Yeah, so
Yeah,
I was I was in the fanning group to do the bylaws, and we had a lawyer, ex-lawyer, which really helped. So we picked his brain. So it was a big deal. We approached the American Student Association. I was involved with them in terms of doing some scholar groups, some global health and integrative medicine as well. So certainly doing a bit of bits and bobs around certainly helps your application look a bit more inviting. I think it's a good move for OUM going to the MD and the research. I think that's certainly a lot of Australian universities lagged with that. I think research is the fundamental basis of evidence-based medicine. So I think having a sound knowledge in that is good. So that was a good move from OUM doing that move.
I would like to invite our student ambassadors to come on video for a moment if you like, or just turn mics on. And I would like to invite you, if you have any advice for prospective students who are thinking of applying to OUM. So I see Jason and Fiba may be ready, so if one of you would like to go first.
Yeah, sure, Dr. Maguire. I'll go. You can see me okay? I take it. I think from my perspective, one of the important things about when I made my decision is to enrol as many people as possible into the conversation about starting university. This medical degree for me is my third or fourth degree, but it's the biggest challenge that I've set forth on so far as learning goes. So my thoughts were to just enrol as many people as possible, making sure that all my friends and my family knew that I was studying medicine. Any questions that they had, I had to make sure for my own satisfaction and reassurance was that I could answer all those questions comfortably. But not only that, but it also helped me to stake my place in where I'm going to be for the next a good 4 years, so that it helped to prepare myself as well as everyone else, so that knowing that I was going to enrol and apply and optimistically get in, it kind of just set the stage. It allowed me to wipe the slate clean a little bit, so that I had no pressures from anyone. There was this common understanding that Jason's just started university again. He's going back and he's studying medicine and he's working full time and he's got a family. Let's just go easy on him for a while. So that was the plan and the strategy about enrolling as many people as possible. And so everyone knew what my intentions were. And that also helped keep the ball rolling, and it started to snowball the process. So rather than pull out because no one knew about it and it was easy to pull out of this dream goal of mine was to become a doctor, but instead I just spoke to everybody. And I even think I remember speaking to Pearce about it before I enrolled. In fact, I even remember Pearce speaking to me when we were studying many, many years ago back at Victoria University. We did our undergraduates together. And he said, oh yeah, I'm going to go back to study. And I'm like, oh, what are you studying? He's like, oh, medicine. Oh, where are you doing that? Oh, OUM. Oh, okay, tell me about that. So Pearce did exactly the same thing. And so for me, it's all about getting it out there, getting the message out there, and making sure that everyone was aligned with my goals. That's the key take-home message for me. Thanks, Dr. Maguire.
Thanks, Jason. I really appreciate that. Fiba, would you like to take the mic?
Certainly. Thank you, Dr. Maguire. I hope everyone can hear me okay. I was quite the opposite to Dr. Pearce and Jason. I actually, kept it very low key because I've got 2 children and I'm a single parent, so I basically do not have time to talk, to work and study. So you know, to just even now, it's just very low key to, you know, some of my close friends knows. But I just keep chugging along quietly. But, you know, I just try to, I guess my approach was like, I wanted to conserve that energy and put that towards my study and to get over the fence every time. And I do not have a healthcare background. I've got IT background. This will be my third degree. So for me, it was really putting in that extra hours to learn something that I wasn't quite familiar with. I started my med school journey with Macquarie Uni a few years ago. Having been in IT for so many years, I've had, you know, medicine was like something that I wanted to do as a kid growing up, but I didn't end up pursuing it because at that time it just seemed like too hard in terms of finances and all of that. So, you know, having worked in IT for quite some time, I was reflecting and I thought, oh, what next? How do I want my next 10, 15 years to be? You know, I've already got about 13 years of experience in this field and I'm kind of over it. And I did one term of health clinical sciences at Macquarie, and I met one of the OUM students who was planning to start in OUM, but was considering Macquarie. And he told me about OUM, and I was like, oh, I don't know, I'm not sure. You know, I was like how Dr. Pearce was saying, Googling and panicking. But anyway, he enrolled and he did 6 months into it, and he told me about the program. And by that time, I had already done one term at Macquarie and I did 4 courses and a full-time job. It was intense. It was crazy. My work was nearby Macquarie, so I even had to go to the labs during my breaks. It was just really hard to keep up with that traditional curriculum style. And so OUM really allowed me to have that flexibility and being able to realize that dream that I had finally. So I took a pause after that first term and I did well, which helped me to with my e-foundations, I must say. I took a pause, and like Dr. Pearce said, you have to save up. You have to have money before you start this. So I've got, you know, IT project management experience. So I've just kind of planned myself financially, my time, everything for the 6 months to, I think, almost a year while I was waiting to start with OUM. And by the time I started OUM, I just had to make sure that things were set up and in line because I had to pull through this by myself. You know, I didn't have a second person to rely on. Decision making wasn't too hard because it was just me who was deciding. So it's been quite an interesting journey, and I'm in my second year. I'm doing mini cases and SBMs, which is great because I don't have to rush to a university and try to find a parking, you know, spend 1 hour. I remember my exams in Macquarie, like I'd be there an hour before my exam and I'd be driving around trying to find a parking. And like running to my exam all sweaty, and I would have forgotten half of the stuff that I learned. Whereas at OUM, I study, make sure I get plenty of sleeps before my actual exam. And on the morning I wake up, I revise. It's much more peaceful. You know, I have more focus, and I really love that style. In terms of what, you know, the future looks for me, I'm not worried. I'm happy and looking forward to those challenges. And I know that OUM's got a really robust curriculum, and I can see that through my SBM courses. Some of them are really intense, and you really have to understand the style of your learning. You have to adjust and recalibrate to every SBM you take. The instructor's style is slightly different. So you have to have a lot of self-reflection about your learning style. Sometimes you have to adjust it. So it's been a great journey. Good luck. And I hope you stick to your decisions, and it is doable. Just go for it. Good luck. Thanks.
Thanks, Viva. Wheela, would you like to go next?
Thank you very much, Professor McGuire. Thank you, Pearce, for all the advices given. So I'm Wheela Lima from Samoa, and I'm from a nursing background, and I I think my background of nursing gave me a very good understanding of the basics that helped me along with my medical degree. And I just want to advise everyone and all the prospective students that you have to be confident with yourself. And I think time management is very important for you, because you will be reading a lot and studying a lot, and there will be no social life for you, but you have to have your time management very planned out well. And you have to utilize all the resources that is available within the OUM. By saying that, you have to ask questions if you are in doubt with your country deans, course coordinators, and lecturers. Ask your academic advisors, because they have helped me when I was in doubt, and they put me back on track. Even the research advisors as well, they will be there to assist you with your research and advise you with everything. And yes, thank you very much.
Thanks, Wheela. Elizabeth, would you like to add anything?
Yes, I'm from the U.S. and I'm came from I was a nurse first and then a nurse practitioner. I've been a nurse practitioner for 11 years, and I'd always wanted to do medicine. Actually, I graduated from nursing school and went pre-med, and then life happened. So, but it just kind of never left my spirit and my desire to go back to medical school. And I looked at a lot of different routes to make that happen in the U.S. And being a mid-level provider, there was just not a lot of viable options without having to practically start all over. So this was why I picked OUM, and I'm really been grateful that there's been something like that for people like me that have been practicing medicine for a long time and wanted to cross over, so to speak. I agree with Wheela that you have to be ready to sacrifice a lot of friend time, family time. You're going to be moving, things are going to be changing. It's sacrifice things that you like to do, but it's for a good cause. I mean, it's like to get something good, you got to give up other things. So just go into that, with all your relationships, and you're going to lose friends and not be as close to people and not get to do a lot of things that you used to do. But I mean, it's for something that you want to do. So make sure that you want to do it that much before you get started. And of course, and then you meet awesome people along the way too. That's the beauty of it, is that you meet a lot of great people and make a lot of new relationships, and you're learning all this beautiful things that get to save lives and change lives every single day. So even knowing that I was previously practicing medicine and getting to do a lot of that, it's been great to take even my practice now, because I still have been practicing as a nurse practitioner to another level. And because I have more knowledge, I have more depth, I have more breadth, and didn't do it to become a doctor, get a doctor behind my name, and for that reason, but so I could have more to give to my patients than I did before. So, but I think it's great. I highly recommend it. Highly recommend it. Be hard, but most good things in life that are worth anything are very, very hard. So, best of luck.
Thanks, Elizabeth. If you're interested in hearing more or speaking with some of our student ambassadors, I encourage you to reach out to your admissions advisor for further information about that. If you have some further admission related questions, you can always feel free to reach out to your friendly admissions advisor or join us for our admissions session coming up in August, and you can get the invitation from you guessed it, your admissions advisor. I want to thank each and every one of you for joining us in our session tonight. I hope that you will take the advice given, and I hope to see you in one of my classrooms soon. Dr. Pearce, I want to thank you so much for spending your time with us. I know you're very busy in multiple practices and with your family. We really appreciate your time, your attention, your honesty, and your candor this evening. So do you have any parting comments that you want to provide to our session before we close?
Yeah, thanks. I really appreciate it. No, it's really nice to kind of touch base back with you guys. It's just two things. Make sure you own your decision. Be proud that you're studying medicine through OUM. And just don't forget to be a good med student first. Don't worry about being a doctor until you've done your degree.
Thanks again, and thanks to all of you. We will see you all soon. Bye for now.